So we came across this story and obviously want to do something about it because you hear these sorts of things and you think, how is this still happening nowadays? But it happens and it continues to happen. So we wanted to hear from the person who's affected by this directly. Her name's AKELIA Campbell. She's 30 years old. And she is suffering with sickle cell anemia. Mm-hmm. Now, we were just talking during the break because I know that there's been a call for people to give blood, but it's not just simply a matter of giving blood. So, AKELIA, first of all, thank you for being here today. We appreciate it.
Hi, thank you so much for having me.
Yeah, it's our pleasure. Can you explain, first of all, your situation? And for, when we ask people, please, to help give blood, it doesn't mean that everyone should run down and consider giving blood. What has to happen here?
Well, the community that is in need would be the Black community. We have about 10,000 blood donors right now, but we need 26,000.
Oh, boy.
As sickle cell patients, some of us receive regular blood transfusions or blood exchange transfusions every few weeks, or others receive it when their blood count and hemoglobin level is too low. It gets dangerously low, it gets life-threatening, and sometimes it's hard to find a match. When that happens, it could be a life or death situation. So you have a better outcome or lesser chance of complication if you find blood within somebody of your own community. This is the reason why blood donations are so crucial right now.
So, yeah, when you said that, we were thinking A, B negative. Oh, it's not simply that. You mentioned from within your own community, so there's something very specific here.
Yes, exactly. So we all know the A, B negatives, O positive, O negatives, but there are other identifiers in your blood type. So if you find a blood type that matches yours, there's other factors that, too, they need to cross-contrast. Okay. If ever they do find blood for you and there is a rejection, the chances go higher and higher if it's not within your own community. So, hence, finding Black donors for those sickle cell patients, given that sickle cell disease is predominantly, not only, but predominantly found within that community.
Okay. What's it been like for you, AKELIA, living with sickle cell anemia and specifically the arthritis that you suffer with?
Yes, so sickle cell disease, and my specific case, I have sickle cell anemia, which most people refer to as the most severe strain, if you would like to say. There are a number of different side effects, but for me, my body is riddled with arthritis, more specifically avascular necrosis or osteoporosis. And that has led me to receive my first my first replacement on my hip at only 22 years old.
Oh, my goodness.
Now I had recently gotten a partial shoulder replacement just 3 weeks ago, and I'm only 30. I will need to undergo further surgeries in the future for my other hip, my other shoulder, and hopefully that's it. But, I mean, there's a likelihood that I might be suffering with this lifelong.
And you were diagnosed at just 3 months old, I understand. So you've been living with this your entire life.
Yes, so it's actually a hereditary disease. So both of my parents have the sickle cell trait. And to put it in simpler terms, they have the gene. They don't necessarily live with day-to-day complications like myself, but they do have the gene in them that they were not aware of until I was born. And I had my very first side effect that was obvious, which is called a pain crisis, which is debilitating pain. And for a 3-month-old, it shows up as hand-foot syndrome, where your hands and your feet swell up. They brought me to the emergency room, and then after a few testing, they found out that I was diagnosed with sickle cell disease, but I had gotten it from birth.
Wow. I'm wondering, too, given that you've had this, as you just said, from birth, have you had crises where, when you talk about blood transfusions, where it's been very, very critical that you had to get blood right away?
Of course, yes. I've had a few instances, more than one instance in my life. Luckily for myself, I was able to avoid that for most of my childhood, but then going into my 20s, now juggling adult life, I was a student, I was working full-time. It's a lot of stress and a lot of daily responsibilities, and I think that was a factor into why I was going into such critical pain crises, again, as I mentioned. Mm-hmm. There was one time it was pretty scary. I was in the hospital for a long time. No matter what treatment I was receiving, my conditioning was worsening. And I received a blood transfusion. The first one didn't work, actually. it was rejected. My body was rejecting it. My blood count still continued to plummet. And then a few days later, I received a second blood transfusion, and thankfully, that one brought me back up to normal, and I was able to start my recovery. So it is very scary and very crucial when you're depending on blood donors and they cannot find you a match.
And so there is no cure. That these blood treatments, this is the only thing that alleviates your pain and makes you able to continue on.
Actually, there is a cure, but it's not eligible for everybody as it is very
interesting.
Risky.
Okay.
Yeah, so it's called a bone marrow or a stem cell transplant, which perhaps you've heard of for other illnesses. Yes. So it's a very brutal and long process. They do tests for your entire body, head to toe. You undergo chemotherapy, then you undergo the transplant, and then there's about another year or so of follow-ups to see if it actually was taken, because your body, again, could reject it. So that's why a blood donation is something that is more accessible. It's something that does not cost a penny for anybody in your community to support you and rally around you and become an ally.
You know, and obviously part of the problem here is because of the pandemic, we know fewer people were giving blood to begin with, so there would be much less of that to begin with. But I know that the blood banks now are appealing here in Quebec, Hema-Quebec, please give blood. And obviously in your case, we're asking please for people, especially if you're within the Black community, it is vitally important to do that as soon as you possibly can.
Yes, you said that correctly. It's vital. It's a matter of continuing your treatment. It's a matter of maintaining what is considered a normal life to you. I mean, of course, my day-to-day would be different from someone else's day-to-day, but in order for me to continue my norm, I would absolutely be dependent on being able to find blood transfusion should my hemoglobin or my medical state plummet and I need urgent care.
So I understand, we're hoping here that Black Quebecers are going to do what needs to be done, roll up their sleeves, donate blood. I understand that Hema-Quebec has a blood drive on in Montreal North this week until the 30th. So is that, I have the Marie-Victorin College's gym.
Yes.
Or Centre Globule Laval. And I believe, and perhaps you can confirm this for us, you can book an appointment online.
Yes, you can. You can go on to Hema-Quebec's website, and they even give you the qualifications. You can also call. A lot of people are just simply not informed or not educated, so they would assume that, I don't qualify, and they don't go any further to look to see if they would be eligible to give blood. But there are many instances, 9 times out of 10, even if you think you cannot donate, you probably most likely can.
AKELIA, are you an actual spokesperson? Because I have to say, you're unbelievably articulate about this. You bring your own personal story to it. Is this what you do? Is this your job?
No, it's not, but I would love to continue in this field to steer away as a career path. I would love to do that. I'm just so passionate. At first, growing up, I was very timid, very private. I almost felt shame until I realized, hey, this is a lifelong illness. I can't do anything about it. Take it as you see it. And I'm just deciding to be a voice for my community.
Well, as Natasha said, I doubled down. You're absolutely a great voice, and I hope they realize that and allow you to speak up about these issues, which obviously affect a lot of people. So we wish you the best of luck at that clinic again, just to let everybody know. I mean, the best way to find out information actually is to go to hemaquebec.qc.ca, and you can book an appointment there. Other than that, they are holding a blood donor clinic in Montreal North at Marie-Victorin's gym, and as well, at the Centre Globule Laval. All right. Yes, perfect. And I would also like to mention to everyone, as well, if you like to follow my journey, as I'm very vocal, you can always follow me on Instagram at Sickle Cell Patient Care. All one word. Thank you so much for the opportunity. You bet. AKELIA, best of luck to you. Thank you so much. Thank you. Have a great day. You too. Special lady, She's something. Wow. She's something. Diagnosed at 3 months of age. Yeah. Living with that her whole life. She just turned 30, I think. She is. She's the perfect spokesperson. Yeah. So articulate and so passionate.